Hey everybody, it's Dr. Jono from Gluck Orthodontics in Nashville. We're going to do a teaching piece this morning specifically around the concern of Gummy Smile. We have a lot of patients that come in and that's their main issue. That's what they want to correct with their treatment. What I want to do is show you 3 different scenarios where the diagnosis or the reason behind the Gummy Smile is very important to figure out because it leads to a couple of different treatment options. So come in, let's look at some photos really quick. So if you look at this patient, what you see is she has a Gummy Smile, shows almost more gum than teeth when she smiles. But if we look at this a little bit closer, what you can see is that the teeth here are actually shorter than normal, okay? So the normal length of an upper front tooth is anywhere between 10 or 11 millimeters. These are going to be about 5, maybe 6, which leads me to believe that this is mostly an issue of extra gum tissue more than anything. And so this usually requires a solution that focuses on the gum tissue. If you look, the patient went and had the extra gum tissue removed. That would be something similar to a periodontal plastic surgery or a cosmetic gum procedure, which you can see reveals the rest of the anatomy of those teeth and really improves with the position of the smile and gets rid of the Gummy Smile. So that would be example number 1. Example number 2 is where you have a patient that comes in who's not smiling but shows too much of the teeth, okay, and a little bit of the gum. And you imagine when this patient smiles, this lip is going to elevate more and show more of the gum here. So the diagnosis here is what we refer to as a vertical maxillary excess, which is a nice way of saying that the upper jaw is positioned too far down in this direction relative to the lip and the rest of the face. And so the treatment for that needs to be aimed at correcting the position of that upper jaw so that it's better lined up with the lip and the rest of the face, which is what you see here. And the last one is a patient who's smiling and shows too much gum tissue. What this is, if the upper lip is normal, is what we refer to as a hypermobile upper lip, which basically means there's a little too much action on the upper lip. When they smile, it elevates too high and you see more gums. The solution for this would be to reduce the amount of movement of the upper lip through something like Botox, either at a plastic surgery office or a dermatologist, to keep this down so that a nice amount of upper tooth is shown when the patient smiles. So again, Gummy Smile, concern that we see all the time. Very important that a proper diagnosis is made to understand the cause or the reason behind the Gummy Smile so that a proper treatment recommendation can be made. Hope you guys learned something. Again, anything that comes up, you're always welcome to reach out to us. AskDrGluck@gmail.com. Give our office a call. We're here for you. Thanks.